And in terms of, complaints generally, what is the sort of mechanism, who to, why and wherefore? Because as I've said to you, you need to realise these things are out there. It's very interesting when we look at the top 10 incidents reported. People often say, oh, I guess they're broken endodontic instruments or crowns that go wrong or oral surgery or whatever. The top one is dental board inquiries. That's the top one. Complaints that go to the boards via APRA and tie you up. Again, you might say, but surely it's technical lack of expertise, it's a bad extraction, it's a fractured instrument, it's a crappy crown, it's a poor endo. No, it's a complaint often about your manner, your charges, the way you manage the patient. That's 25% of all complaints, and increasing, not decreasing, increasing. But who can the patient complain to? It's never been easier. The patient can make a complaint in their laptop. You can sit back in your lounge room in your smoking jacket with a big cigar and fill it in online out to APRA. And if you don't want to do it through APRA, you can do it through, let's say, New South Wales. You can use the HCCC. And if that doesn't work for you, you can find the Consumer Tenancies and Tribunals people, the CTTT, and then you can send it onto the board. It's just, you can complain forever. The list goes on and on. Because patients are empowered. They have the rights, and there are so many avenues. In Victoria, the Health Services Commissioner, the Australian Dental Association, the Dental Board of Australia, Victorian branch, directly to APRA, numerous bodies. Too many to think of. You can complain to all of them, and of course you can tie that unfortunate practitioner up for 1, 2, 3, 4 or 5 years. It's never been easier. And so let's have a little look at it, again, the reality of life. But surely dentistry isn't risky. I mean, what about, those people like, say, psychiatrists or psychologists that have patients that are disturbed, a little difficult, and perhaps they're in a one-on-one situation without a dental assistant nearby? Wouldn't they be at risk of getting into all sorts of problems? Not really. They're coming in about 1.2%. Where do we come in at dentistry? Right up the top of the list, baby, 5.8%. And if you say, oh, I'm lucky, I come from Queensland though, and we don't have that sort of thing up there. No, you're real unlucky. Queensland comes in nearly 9%. They really beat the average. So, again, dentistry, interestingly enough, is really in the firing line. If you want to do something safe, be a physiotherapist or something, do something like that. But not dentistry. Not dentistry. What happens when you get a complaint too? All right, you've tried to do your best, things haven't worked out and a complaint's occurred. What happens? Well, first of all, the complaint's got to be referred to the dental board. Within 60 days, they've got to make an assessment on the complaint. And the board can take immediate action. If they look at that complaint and say, you know what, we assess that he or she is a danger to the public, and we don't mean a danger running around with a gun or something, we mean a danger in terms of their standard of treatment, kabang, your registration goes, finished. If they don't assess that, they can sit down and say, we'll ask you to make a submission, and then we'll sit down, evaluate that, we'll look at what we do further. That might involve a performance assessment, that might involve a professional standards panel, that might involve a lot of things, all of which are going to take up a lot of your time. They're going to cause you a lot of heartache and a lot of sleepless nights. So this isn't fun stuff. Even little things like, for example, a performance assessment. What does that mean? Some guy comes and has a look at what I do all day. I'll just show him my patients and he'll... No, they're going to go through the cases that were complained about. They're going to review all the records. They're going to look at the treatment records, the clinical management. Then they're going to look at some of your other cases out of the... Oh, I forgot to fill out the records for that lady. I was going to fill those out. And of course, if your performance assessment is unsatisfactory, what happens? Let's say we look at your records and we say, you know, unfortunately in terms of crown and bridge work and endodontics, your records and similar don't measure up. What happens to you? Well, first of all, you don't practice crown and bridge work and endodontics until you've shown that you've changed your ways. That could take 3, 6, 9, 12, 18, 24 months. But what am I going to do about practice in the meantime? That's your problem, not mine. But I've got an income to earn and I've got rent to pay. That's your problem. That's not our problem. Can you understand these things can get very ugly? Can you also understand that even if APRA says to you, well look, you've been a naughty boy or a naughty girl, we're going to have to give you a reprimand, and you say, oh, smacky smackies. It's not too bad, is it? But unfortunately, you see, it's the end of your career. Because every time after that, when you go to apply for a job, what comes up when you hit the APRA website under your name? Reprimand. Does it say whether it was for bad records, or does it say because you were a mass murderer? It doesn't mention. Would you employ a mass murderer in your practice? I don't think so. So already we've seen that, where people's career suddenly comes to a grinding halt. What I'm trying to tell you is this is serious stuff. You know, this is not, it's not the sort of thing where in days gone by you could sit down and you had a few buddies on the board and you'd have a chat and say, listen, go easy on me, and they'd go easy on you and you have to do a few courses, and it wasn't the end of the world. All of this has changed. The situation's become more adversarial. Patients have become more adversarial. The ability to complain has never been greater. And as a consequence, dentists are really topping the list of most professions in terms of complaints received, which is an achievement, but probably not the sort of one we want to have, you know? Not the sort of one we want to have.